Okay, so we're gonna do the abdomen, the belly. And actually, what you do is there's no like a straight technique that you have to use. Use your plastic surgeons, use your imagination. But there is a basic technique that you can use and follow. And it's you put on the same kind of pattern all the time. And you can build it from medial to lateral. So we're gonna put not so many of those 29, gosh, those are too small for the abdomen. So we're gonna use the 27 and some of the 25. And you're gonna put them in this kind of direction. And you have to be sure that you don't pass this area where the fascia is. And you have a picture of it maybe in your papers. So it's not complicated at all, just you have to get the technique doing it. And then you can go on and on and on. And the belly is a bit more painful for the patient, so you have to be aware of that. And also, when you've done these threads in this direction, you can stabilize these going upwards with some threads like this. And here. So, I want, yeah. And here you can use a lot of threads. It depends on how the belly looks, how much the patient is willing to pay also. And it's a bit more difficult to get a really visible result here with fewer threads. So you have to use a lot to get a result. And now the gray ones. Thank you. So we're gonna do in the same manner. Just let me know if it hurts and I will stop. Stretch the skin.
What type of thread is that?
This is 27, mono. Who asked? Sorry? Oh, okay. It's a 27. And here the skin is more mobile, so you have to stretch it. So you can keep it like this close to each other. It gives better result, of course, or keep like more distance. It depends on how many threads you want to use. And on the stomach, here on the belly, you might feel sometimes that if you have stretch marks, you might feel some resistance when you're putting the needle in and the thread in, because there are some like scarring in the tissue. Is it okay? And if you have done a couple of thousand threads, not on this one, but in your life, you know the technique and it's going to be so easy doing it. How does it feel?
When you control before it's easier.
Okay, just...
Tell me something, is it better to put a lot of monos on the belly or less thread parts?
I usually put a lot of monos, the bigger monos. You can use barbs, but it depends on the belly as well because it's more mobile and it's more like flexible skin here. So there is a possibility that you can see how the barb is like going if you use barbs here. But of course you can. It depends on the structure of the belly. So this is actually how you go on and on and on. I'm going to do this part right now, but later if she wants more, you can just go on to the more laterally. May I ask you something? People who have been using threads here before, how much do you charge for one thread?
About 10 to 12 euros.
10 to 12, okay.
I'm talking about me, I don't know about the others.
Yeah.
What in Sweden, how much do you charge
Per thread, approximately 30 euros.
We'll try that.
But it depends. You can, of course, give some discount if you're doing a big part. That's what I do with my patients. So I always give discount if they want to do a... Oh, sorry. If they want to do a like total facelift, I usually give a discount.
A little less. I don't use other figures. I don't know about the others.
So around about 250, 300.
For 1 milliliter.
Yes.
Okay.
So yes, we charge in Sweden around about 350, 450. Yeah, 350, 450.
And what about Botox?
About
Botox.
Botox, 3 areas, around about 600. No, I understand from today that we have very different prices here compared to here.
The idea would be to work there and to live here.
For those of you who have been doing threads, how many patients have you had, like per week, or? Are you okay? Okay.
I think also as a clinic today to promote that you have thread treatments shows that you're very innovative and will probably give you also
Can you count?
many steps ahead compared to your competitors. So I think it's a very good idea to really start with the treatments in your practice now.
Which one? No, that's okay. I know. Okay, now I've done a couple of them going horizontally and downwards. Gonna stabilize these going upwards. And the gray ones. I think it's very important to, whenever you use the threads, even on the face and on the chin or the neck, stabilize them. It gives a better neocollagenesis, and the threads are then, as I said, being stabilized. It's the same with the fillers. When you're using them for wrinkles, you always cross-link them. You feel this, right? She can feel this. She has some, sorry to say, but some stretch marks here. That's why she's feeling when and I feel some resistance when I'm taking the needle in. On the face, I've used it on people who had had acne before, and that hurts for them, but it gives a really nice result later. So for people who use like any chemical facial treatments or anything like that for the scars they have had from acne, I think this is a new kind of thing it can be used for.
What you're saying is that if you're treating a face with acne scars, it will be a bit more difficult to get the needle in, correct? But,
Yeah,
but it's worthwhile, the results are fantastic. Yeah.
Exactly. I've had patients who had acne when they were maybe 25 and now they're 50. Mm-hmm. They've tried a lot of different treatments for this, but the threads, it was a bit harder to treat them with the threads. But after 3 months, the result was really nice. I'm sorry, I don't have the before and after pictures, but I will probably get them and maybe Martina can email them.
If anybody wants to.
And then some doctors are using the syringe. You can also use the syringe to connect these ones with V-Soft Lift on the top. It maybe makes it better to use the threads. It's up to you what you like. And what's really good with V-Soft Lift is that we have different kind of threads, which some people haven't seen before, and those are the mini ones. I'm sorry we don't have those with us today, but they are really, really, really small ones, and you can actually use those in the contouring of the lips for treating the wrinkles, the smoking wrinkles. They're really nice, and I know I haven't done it, but one doctor actually used it for the upper lid. For patients who have wrinkles on the upper lid. He used maybe 50 of them on one upper lid. And those are really small, and the result was fantastic there as well. So there are many different kind of threads. And those mini threads, you can use them in the scars, or not in the scars, I'm sorry. I mean in the wrinkles. And after a while, instead of using fillers, after a while, 1 month, you see that the wrinkle is gone. So maybe 2 mini threads in one small wrinkle, and it's gone. Threads are really effective for the forehead, especially the glabella, instead of Botox. And it lasts approximately 18 months. And on the glabella, you can build a mesh over there too. So I think threads in a combination with Botox for wrinkles on the forehead, that's amazing. Instead of using Botox with fillers, for example. And on younger skin, I've had some patients who are only in their mid-30s. They have a really good skin texture, and elasticity is really good, but maybe they just want to lift one side. They have maybe a asymmetry, want to lift one side of the lateral part of the lip. You can put one barb, maybe just on one side, just to make it more upper. So you don't have to treat the patients for a full facelift or a full like abdomen. You can use just 2-3 barbs on a face and make a difference. So, this is like the basic for the abdomen. It's nothing complicated. You just have to know the technique to put the needles in, and you can work for the whole entire abdomen. So I'll do just this part here, and then, right? I'll do just this part here, and then the next one, the next side. Is that enough?
Just go ahead, yes, that's enough.
Yeah. I can have the orange ones. You're okay?
You put the same number from the other side?
Yeah, I'm doing the other side. Approximately. I usually don't count. You just go with the feeling. So how do you people feel so far? Okay, any questions? Sorry. That's a scar underneath. Are you okay? Thank you. And also, as I told you before, you can always bend the needle like this if it makes it easier for you. you okay? Orange? Yeah. I'm going to show you the 25. And this is 2590. And these are a bit longer. And it's actually kind of more difficult to use these if you're not very experienced. It's because you have to always be in the same level. And this is longer, so it's bending a bit more. I think you have to go there. Are you okay? Okay. So I'm going to go like this. Okay. Done. Okay. Done. Soon. Done. So you can put these 25 too on the abdomen, no problem. But it hurts a bit more, I think. Yeah. And for the barbs, you can put the barbs, but I recommend that you put silicone with adrenaline on the insertion point here. And if you're going to put barbs, then go from up to down. And then you can just go on and on and on with the stomach or the belly. I actually recommend that you do a few first and a bit more laterally too, and then take the patient in again for after 1 month and see if you can complement with something. So that's how you do the abdomen. This will give a slight good result, but you have to put a bit more to really see a result of this. Does it feel okay? Okay. And then remember to just keep this area clean with alcohol and everything today and tomorrow. Sorry?
With the gym, can I go?
Oh yeah, the gym, I've always had this question, is it okay to go to the gym? I recommend not for usually 1 week, 4 days, that's okay. So rest and not too heavy exercise or sweating. And no sauna, which we have in Sweden. So, yeah. Okay. Thank you, are you okay?
Thank you.